Tips or information about a child with Apert syndrome. Tip 1. Understand what causes Apert syndrome. Genetics. A person who has Apert syndrome has a 50% chance of passing the gene on to his or her child. Spontaneous occurrence. Sometimes, a child will be born with Apert syndrome, even if neither parent carries the gene. A defect in one of the baby's chromosomes can lead to Apert syndrome. Tip 2. Consider what the term syndrome refers to. The term syndrome means that there is a group of symptoms that consistently show up together. For this reason, one person with Apert syndrome may have a combination of symptoms, while another person may have a different combination of symptoms, but they both have Apert syndrome. Tip 3. Be aware that the most common symptom is a malformed skull. This is also referred to as a peak head. This happens because the sutured bands of tissue that connect the bones of the skull and the skull close up too early, creating ridges along the suture lines. The topmost part of the skull bulges because the closed sutures put extra pressure on the child's brain. Tip 4. Understand that one symptom is that the eye bones are formed high or far apart. The skull also has lines inside the fact that can be affected by this syndrome. If they are affected, the bones in the face can move upward on the head. This causes the child's eye sockets to become very shallow. Tip 5. Know that another symptom is having ears that are lower on the head. While a person with this syndrome's ears may be shaped and sized normally, they may be placed lower on the head, closer to the jawbone and more forward on the head. This displacement of the ears can lead to hearing troubles. Tip 6. Be aware that the child's nose might have a flat bridge. A child with Apert syndrome might have a smaller nose that has a flat bridge. This is because the nose bones fuse together before they get a chance to form fully, leading to a smaller than average nose. Tip 7. Know that cleft palate is a symptom of this condition. A cleft palate is when the roof of the mouth does not get a chance to fuse all the way because the syndrome causes the bones to fuse together prematurely. A cleft palate can be accompanied by crowding of the teeth or an inability for the teeth to fully form. Tip 8. Understand that Apert syndrome also causes a fusing of the fingers and toes. During a baby's development inside the womb, the fingers and toes do not fur distinctly but instead fur like a paddle, but in a normal child, the cells between the fingers and toes will die, forming distinct fingers and toes. Tip 9. Be aware that someone with this syndrome may have challenges with mental capacity. Often, when a child has Apert syndrome, their brain is not allowed to fully form because the bones of the skull put pressure on the brain and keep it from growing and forming. In most cases, the child will not have a fully functioning brain, making the child disabled. Click the link below or follow this link https://askthenurseexpert.com/category/Apert syndrome for more tips or information about a child with Apert syndrome.